Hi, my name is Selma Canales, and today I will be discussing the disease cystic fibrosis. These are the contents. I'm going to be discussing the signs and symptoms, the causes, the pathopsychology, diagnosis and monitoring, management, prognosis, epidemiology, history, research, and society and culture. So, cystic fibrosis is a chronic disease that affects the secretory glands. They are responsible for producing mucus and sweat. So this just means that you overproduce mucus, causing a malfunction in the lungs, pancreas, liver, intestines, and sex organs. The symptoms are usually different for adults and children due to, infants and them not being able to speak and not being able to discuss how they feel, and adults can pretty much distinguish what type of emotions they're going through and how they feel and the pain. So in children, it just consists of them having salty skin, chronic respiratory systems, wheezing, coughing, lung infections, poor growth, and constipation. Some parents do get confused with the wheezing and the coughing and may wrongly diagnose them with whooping cough, but there are ways to differentiate the two diseases. So men who have this disease become impotent because they lack a very vital organ which causes them to ejaculate, and women who have this disease have a very large time or very difficult time conceiving. The causes for this disease is primarily genetic. So when a parent passes down a CTFR gene to the child, they have a 50% chance of inheriting it when they have a normal gene and a faulty gene. So the chances increase when a faulty gene is included, and the chances decrease when a faulty gene goes away. But they still have the chance of getting CF. The chance does not go away. And pathopsychology. The types of complications in patients with cystic fibrosis are different depending on the type of CTFR mutation. Some patients experience constant pain in certain regions of their body, while others tend to have a different perspective on the types of pain areas. Though this is a disease which affects the hepatotopic system, the gastrointestinal system, the endocrine system, and the reproductive system, many patients tend to have increased pain within the gastrointestinal and the endocrine system. So they have to be constantly taking medication, anti-inflammatories, and antibiotics to decrease the inflammation and help ease the pain and to relieve any bacteria which may be lingering in their body. Diagnosis and monitoring. CF was initially a pathological diagnosis, but after 1989, there was a gene that was identified, and this completely changed the whole method of diagnosis. Instead of doing mainly sweat tests, they now incorporate gene testing, which helps them catch the disease on time and help create new and improved methods of treatment. Management. The whole concept of managing this disease, since it is incurable, the patients who have this disease have to live with it for the rest of their lives. They just have to be constantly be given fluids and nutrients, such as vitamins, and they have to be, the nurses or whoever will be taking care of them have to be constantly checking for lung infections and to remove any sticky mucus from their lungs and preventing blockages from their intestines. So they have to be given fiber and all sorts of medication to help them cope with their disease. The prognosis back when it was first discovered in 1938 was crucial and deathly. They only had approximately 6 months to live. But now with increased technology and advanced medicine, they can live up to 40 years of age, or 47.7 years of age. And with new research, it is approximated that within the next 50 years, their life expectancy should increase to roughly early or mid to late 50s. The history. History of cystic fibrosis. When it was first separated between celiac disease in 1938, was only 6 months. Whether, adults or children had this, they only had 6 months to live. So back then, it was very hard for people who had this disease. But since 1959, there was a sweat test that was incorporated, and in 1955, centers who had aggressive and comprehensive improvement increased and helped individuals with CF increase their lifespan. And in 1989, the discovery of the CF gene helped doctors and scientists create new and different opportunities of research and treatments. So now the life expectancy has increased to 47.7 years of age. The research as determined by CF organizations such as the CF organization alone indicates that life expectancy should increase within the next approximately 50 years. So the lifespan as of 2012-2016 is 47.7 years of age. So each year it starts to increase. But here in the picture to my right hand side, the image indicates 48.8 years, but it all differentiates, but the life expectancy is in the 40s. 1 in 25 people carry the defect for CF. So a person in our classroom, approximately 25, 30 people, may have this may carry this gene, Society and culture. This disease is primarily in Caucasian people and Latinos and Native Americans with a certain tribe descent. Though this gene is specifically in those people, it does not only include those people. It's majorly in those people, but it does not exclude. So anyone, of any race, of any age, is able to get this disease. But our society and our culture does have an influence, but does not strongly influence this disease. And it's not airborne, which does not mean anyone around you can get it. It's not contagious. It's a disease that you're going to live with. But you can live a healthy life if you are able to receive the nutrients provided to you. And these are my works cited. I hope that you enjoyed my presentation.